Ready? Well, greetings. Hi, my name is Elton Brewington, and I have the good pleasure to have on our call today Dr. Sanjay Prasad, and he has written an incredible book, and I'm right there with him, and it's called Resetting Healthcare, and an amazing opportunity through his company that helps resource new procedures for surgeries. And me and Claire are so excited to have Dr. Prasad on the line. And he will share with us details about his experiences as a career physician. And he's going to share with us aspects to his book, tell us about how he came to acknowledge and present information about your book. But we're certain that this could transform healthcare, how we procure different surgical procedures, and some of the pitfalls that we need to be aware of, and how we can move through a procedure like these, or many like these, in a very pristine and clean way. So without further ado, Brightside Global Trade TV is proud to present Dr. Sanjay Prasad. Please, Dr. Prasad, tell us about yourself, your book, and experiences and endeavors and expectations. And we'll come back with questions.
Elton, thank you. First of all, thank you so much, Claire and Elton, for allowing me the opportunity to talk to your audience. It's a very, very important subject. I was talking to my mom just a couple of weeks ago, and she was relating to me the story of how we came to this country. I was born in India. I was born in Delhi. In 1962, I was 1 year old, family of four, and we traveled to this country. My dad had an opportunity to come to the United States, and he took it primarily because, we had a healthcare problem in the family, and we were seeking a solution for that problem. And so we went on it was a month-long journey back in 1962. Nobody was flying. So it's hard to imagine for kids today, but we went through the Suez Canal. My mom was vegetarian, and all that. But we came to this country. We found the right surgeon to address the healthcare problem. I grew up here in the Washington, D.C. area, went to medical school here, and became a surgeon. And I've been a surgeon for about 30 years, and very somewhat distressed by the problems that patients have in terms of navigating the maze and trying to get to the right surgeon. So it's really unbelievable how my upbringing kind of leads me into my adulthood, because here we were a family trying to find the best healthcare for a solution for a problem, and now I'm trying to help millions of patients try to find the right surgeon within their network. So it all comes full circle. It's just amazing how that happens.
It is amazing. It's almost as if you knew that's what you were going to do. You could have saved yourself a lot of time.
Yeah.
But you probably needed to go through these elements to do this that way.
Yeah, I mean, the timing wasn't right, early on. And I think the technologies were not mature enough, and, HIPAA compliance and et cetera. There were many barriers to doing what we're doing today. So, and right now the technology is such that, what we're doing is the problem as we see it is really that referral from the primary care physician to the surgeon. That referral is not made necessarily on the basis of cost, or more importantly, the surgeon's outcomes, but it's really been made on the basis of habit. Primary care doctors usually have a sheet of referrals in every specialty that they normally send patients to, or referral nurse handles that for them. But they don't have all the metrics, the measures for each surgeon for each procedure. I mean, how can they? They have a limited amount of time to spend with the patient, send the patient for a referral. So we are, and somebody called it earlier today, a reference, we did call it referral optimization. And if there's something that we're doing, that's exactly what we're doing. It's referral optimization.
But
and that's so important, that you get the right referral,
But
especially when
and
it comes to your health.
in the previous discussion, though, I see that by adding a level or aspect of competition, it makes, a very unique perspective with what you're presenting. And, you're actually, and it, of course, unfortunately, the cream rises to the top, but it's okay as long as, you get good results. Every patient, of course, entering any kind of procedure this way is looking for great result, And we're trying to help assimilate that and also put that into some kind of context or order. So that's amazing. That's quite
So,
amazing.
one of the things I can tell you is that what's happening today, and depending on specialty, 15 to 30% of surgeries that are being performed today are unnecessary and don't need to be done. And patients are getting connected to surgeons. They're getting unnecessary surgery. They're getting complications from unnecessary surgery. They're getting surgery from surgeons who don't necessarily have the best outcomes. They're getting infections. They're getting the wrong size implant put in. They're having the need for revision surgery. The system is just not working as well as it could. And what we're doing really is we're turning the tables, if you will. We're turning the tables and forcing the healthcare system really to compete on the basis of their surgical outcomes for the patient and for you when you need surgery, if that makes sense.
Oh yes, oh yes, it does. I mean, as a matter of fact, I chime in on your suggestions because I remember attending a conference in Singapore, which had to do with medical devices.
Yeah.
And even the promoters and manufacturers were suggesting, no, one manufacturer who manufactured knees, actual knee joint elements, and said that they had the misfortune of being able, or they sent almost a million knees that were defective overseas. A million knees. Now that's startling, and I mean, so when you think about something like that happening, and what it means, and I don't know, I don't remember the details that the presenter's descriptions, but very careful considerations need to go forward with supplying and producing, and we were all astonished by his presentation, but he was credible and reputational. So this means that Surgiqual can do a great service with our community, and long-term benefits and preserving health, preserving health. So big deal, big deal. hmm Mm. So now, in your endeavors to help promote better health and better outcomes, I guess we could say, better outcomes throughout. I mean, and being conscious of many of the areas where people can, fall victim to. It's because the word will get out, and your service will reach a demand quotient. And what is your thoughts about how to overcome that? I mean, because right now it's based on the insurance carriers and whether they add the value to your or add value with using your service.
Well, patients today, whether they belong to Blue Cross or Cigna or Aetna or United Healthcare or Medicare or Medicaid, they have a network, right? They have a network of physicians. They have a booklet or something online where they have all these orthopedic specialists or all these neurosurgeons, pain management physicians. They have a whole book of different specialists who are part of their network, but they have no way to pick the correct surgeon, the right surgeon with the best outcomes for their condition. So what we've done, Elton, is we've added, it's a two-pronged process. One is personalized concierge service, and it's essential, right? When you're doing healthcare, compassion is extremely important, because if you think this is just a technology play, you're going to lose. Everybody's going to lose their shirt. We have to have compassionate care The patient needs to be handheld through the system. We have to make it easy for the patient. What we do is we just have them sign a little HIPAA release when they're told they need surgery. And that allows us the authority, right? They give us the authority to source their medical records, to source their imaging if they've had a CAT scan or an MRI that's shown a torn rotator cuff, for example. We source their records, and this magic happens on the back end. Once they sign this agreement, we source their medical records, source their imaging, send it up to the HIPAA compliant cloud, and then we send it to all the surgeons within their network. And remember, these surgeons are very different. So everybody thinks all orthopedic surgeons are the same, but they're not, right?
No.
So there's a subset of orthopedics that are fellowship trained, that do spine surgery. Some that do hip replacements have done really fellowship training in that. So we're honing in on the surgeon by specialty, but honing in on their area of expertise.
Sure.
So we're connecting these patients to surgeons within their area of expertise. And there's something else that's really interesting that happens because we're connecting cases directly to surgeons based on area of expertise, not on specialty. So what's happening now is you have multiple specialties that can offer an opinion about how to manage a condition with the same area of expertise. For example, a colon tumor can be managed by a colorectal surgeon who suggests that you may need to have half your colon removed, but it also, that case can go to a gastroenterologist, a stomach doctor, who can perhaps even use a colonoscope, a minimally invasive procedure, remove the cancer, be back to work, 1/10 of the cost, a quick recovery, and save on lost days, and zero mortality. So these are some of the things that become possible when you can have a system where you can send medical records in a safe and compliant way.
What an incredibly brilliant solution, though. I mean, you're asking physicians, one, to bid on your case, two, to evaluate according to expertise and background what their solution alternative might be. And what it also does is it forces physicians to do more research, to evaluate better courses of action, which produce greater outcomes or better outcomes. That's outstanding. That's really outstanding and a great procedure to move forward to. And when you think about the patient volume, it really supports a better alternative for patients. Really a better.
Also, I'd like to add that when you think about rural areas and what we just went through with the pandemic, where people had to wait for surgery, which was the first time in the US for a very long time. And then you start realizing that that wasn't that urgent and that you could have taken a minute to just stop and think about all the options that you have. And I think with surgery quality, this is a new option now that we didn't have before. So can you tell us about how this could save tons and tons of time and resources, and leave alone the financial, but it's just so convenient now with what you have to offer?
Well, Claire, I think you said it pretty well. Look, the pandemic really forced surgeries to be paused. They couldn't get done last year. Patients were starting to be afraid of getting coronavirus from entering a hospital setting or a surgery center setting. They were fearful of leaving their home. And now all of a sudden it created this awareness, although we've been talking about MRSA infections, methicillin-resistant staph infections, but it didn't quite resonate with patients. But this coronavirus really resonated with people. But that pause was extremely important, because you're absolutely right, Claire. These patients are starting to realize you don't need to make an abrupt decision, that when a surgeon tells you need surgery, you need to pause and you need to start to reassess. And you need to ask tough questions. Doctor, do I really need the surgery? Are there alternatives to surgery? What would happen to me if I didn't have the surgery? And then they need to ask some very difficult questions. Doctor, how many of these have you done last year or the last 5 years? And what was your success rate? And what does success look like? And were there any complications with any of your patients? And did anybody die? And I think these are very reasonable questions to ask. Patients just don't have the wherewithal to ask the questions, and they don't have the wherewithal to understand the answers. And that's where they need a concierge platform to help them, elevate their healthcare IQ, because this is very understandable. If healthcare is presented in the proper way, it is understandable to 100% of the population, no question.
When you think about patients in this total experience, I'm sure that many of these patients under these considerations are gripped with fear. They're terrified. Just the thought of a surgery and having to face a life-challenging condition. I'm sure they're just gripped. Fear is overwhelming. But by handing, and the whole idea for any
Elton, we lost you. I actually have a true story. One of my very close friends her husband had to have a knee surgery. She was in the middle of a work project. She had no time. So they got him into the surgery room. She signed off on all the paperwork. He had the surgery, and then they realized that he didn't need one. And her husband said, "What kind of wife are you that you would just sign me away?" And she was like, "Well, I was in the middle of all these projects, and I just trusted the doctor's opinion, and I just and I started thinking, as a wife, you have you're entrusted with someone's life, and are you just going to go there and just sign all the papers, and next thing make decisions for your spouse that could go wrong? And so we hear these stories over and over again. And so let's dive into the book. I think the book is the first step.
Let me just go over one thing. Elton, you're so right. People are scared.
Yeah.
They're told they need surgery, and they go straight from the examination room and they go right to the scheduler's office to schedule the surgery.
Sure.
And it's all about planning and organizing their time.
Sure.
But they need to pause and rethink, right? Rethink what's happening, right? And Claire, to your point, I think it's important when you go see a surgeon, he's about to recommend a treatment option or surgery, very important to have your spouse or loved one or whoever there might be that you trust, even a dear friend, to go with you, take notes, right? And because you are overwhelmed. I mean, you've been told you need surgery, you're anxious, you're panicking. Look, these are the things that go through people's minds. It's really interesting.
Terrified.
People just panic. I know.
Psychology is even great, even more compelling when you consider that if you're the only caretaker for small kids, right? Little kids, and you're the only one who takes care of them, how can you possibly think of undergoing anesthesia? What's going to happen to my children? Do I have enough disability insurance? Do I have life insurance? I mean, are my parents going to take care of my kids? I mean, these are all real scenarios, right?
They're huge questions, and they demand answers.
They demand
answers.
They do.
So at the end of the day, our effort and yours, of course, and how we proceed, you want to let people know that there are options, that they have options, and who you connect to. And from an insurance supplier point of view, if a consumer or customer can know that my insurance provider is taking care of every plausible condition and option, then I can trust them to take care of this. I can trust, Surgiqual to make sure that I get the right surgeon, or if possible, not get the surgery at all. And so in that regard, amazing.
It's almost like having a second opinion, really. Surgiquality is almost like having a second opinion. It's also something that gives you the time to really think, as you put it rightly in your book, Dr. Prasad, reset. We did an interview with a neurologist recently, And really the brain is so tuned to what you've been like, surgery to me now in the United States has become like, like popping a pill. Someone else had surgery and everybody had surgery. So you just automatically accept it. Gone are the days when, people would, take months before they, scheduled their surgery. And I think that you do need a reset. You need to reset your mind, reset the way you think, go back to the old days where you took consultations, you talked to people. These are not decisions that you just make like, right away as soon as you're diagnosed. So I want to dive into the book a bit because I think that that's the first spot when people start reading your book, that they start to think again. And I say think again because just like you said, during post-COVID, it's making us think again. So tell us a little bit about the book. And I know you call it the Patient Handbook. And it seems to me an essential book for anybody that is going for surgery or may have surgery in the future. But tell us a little bit about the book.
Yeah, Claire, just before I get to the book, this is more than a second opinion service, right? There are a lot of second opinion services out there, right?
Mhm.
But this is a way of peer reviewing the surgery. In other words, we're taking your network of physicians and we're asking them what have been their past outcomes. And we're asking them to compare their past outcomes with their peers. So it's a second opinion, but it's a multi-opinion service, really on steroids. It's on at another level.
Mhm, mhm.
The book is entitled "Resetting," resetting healthcare post COVID-19 pandemic, and it is the patient handbook. It's written so that patients can understand, their. I'm sorry. Thank you so much. It's so that patients can start to understand what's happening in the healthcare maze, and they can, get back behind the steering wheel of their car and navigate the maze, if you will, right? So it's written in a very understandable type of language. We have some stories in there. We have some case reports in there. We talk about the marketing influences that have happened, over time with the healthcare industry. But I want to emphasize one point that's it's really rather important. Patients think that if they go to a name brand institution that they're going to get the best possible care, and I would ask patients to pause, to reconsider, because the quality is really related to the surgeon. And so, are you going to get a surgeon who just finished his fellowship training, who's just starting to do a few cases? Are you going to get the surgeon who has a lot of experience with the latest technologies? Or are you going to get an older surgeon who didn't train with the current technologies, was more adept with older technologies, and is taken secondarily on to educate himself with newer technologies and may not have the best outcomes? So it's impossible for the patients to know, right? So that's why the quality measures have to be very specific to the surgeon and can't be aggregated. You can't just look at metrics and measures from an institution and say it applies to all their surgeons, because that's not the case. We know that, right?
Right. So that's awesome. So in your case scenario, we're presenting the patients on the average with a few options according to review. Now that puts you really in the driver's seat. And say you get 3 to 4 reviews of physicians, their experience background, their capabilities, a resume review, so that you can now, make a very informed decision about your procedure and your, solution, so that it gives you great confidence. I'm certain, gives you an incredible level of confidence to be able to make a review from that kind of perspective. And so
And that, yeah. So another thing I'd like to ask you about is people like me and Elton, diversity groups. I think that, for so long, we are just blended with the general population, and yet we have specific needs for diversity and health disparities. So how do you think this resetting healthcare and surgery quality would help a patient like me and Elton?
Well, Claire, I'm glad you brought this point up, because I'd say about 10 months ago, I was looking at unnecessary hysterectomy rates. And
Yes.
this is where my research started. I was quite astonished that Black women undergo hysterectomy at
Mhm.
4 times the rate
Mhm.
of white women
Yeah.
in this
Mhm.
country.
Mhm.
Now, the studies did not control for extent of disease, did not control for comorbidities, but nevertheless, 4 times the rate. There's something more going on here, right?
Mhm.
So I
Mhm.
started exploring the literature, and I found a wonderful study by Hayter, the Brigham and Women's trauma surgeon, and his team. They did a meta-analysis. They looked at 88 articles, 88 studies of racial disparities in surgical outcomes. I was absolutely blown away. It's
Mhm. Mhm.
astonishing how Black patients have poorer surgical outcomes than white patients, and the disparities persist even when you control for
Mhm.
socioeconomic status, extent of disease, comorbidities. Look, the system is not working. And I'm not saying necessarily that it's bias or racism or discrimination on the basis of surgeons and facilities, but I think the healthcare system traps patients into a certain healthcare set. So what do I mean by that? Well, I think what happens oftentimes, and I give the example of a Spanish-speaking patient who goes to a Spanish-speaking primary care doctor, who goes to a Spanish-speaking surgeon, but that surgeon is not necessarily the guy who has the best outcomes in the entire network. So what we're doing with surgery quality is something very interesting and unique. We're taking the medical records from Black patients, from all patients, anonymizing it with name, race, and ethnicity. And now we're sending these cases all in a safe and secure, HIPAA compliant manner to multiple surgeons throughout the network. So if they have aortic stenosis or a narrowing of one of their heart valves, they can find the best TAVR surgeon, the guy who puts in endovascular, valve replacement grafts, and who does it with high volume and high quality. Because one of the things all these studies show is that Black patients tend to end up in low quality, low volume surgeons and facilities, and they end up with poorer outcomes. So
Yeah.
this is how we can
I,
fix the problem.
Mhm.
I
Well,
I couldn't agree more as a woman, because I have so many of my friends that have gone through the hysterectomy surgery and was so unnecessary. A friend of mine who's my age met with an accident, and she went for diagnostics. Next thing, she called me to say she's going for, and I said, don't, it has, you may get cancer from it. And right away she did, and she passed away very recently.
Oh,
But
sorry.
it's so true, because it's kind of like an automatic diagnostics that comes out and over and over again. And Black, Asian, Indian, Asian patients, we need more specific, we need that extra step that you're talking about. And so I'm so glad that you were able to populate diversity to be able to come out with a more better outcome. So Elton, do you have a question on diversity? We can't hear you. You're muted. Yes. This is a big topic. And yes.
inconvenience, but I just want to wrap things up. I want to bring us to a point of your final solutions and alternatives, doctor, to help us put into context what can happen with such a sustainable and very profound solution. When you designed it, were you thinking huge installation. I mean, if this was to be installed on a requirement basis today, what would things look like?
Well, look, this platform should be the standard of care
Hmm.
for the
I
United
agree.
States.
I agree.
If we're going to move to the next generation of healthcare, and if we're going to use technology, and if we're going to progress to the next level, this is going to have to become standard of care. I don't care if you have Medicare, I don't care if you have Medicaid. It doesn't matter what type of insurance you have, you don't have insurance, or whether you're with one of the Blues or United Healthcare or Cigna or Aetna. It belongs in every possible realm, because this is technology has made all of this possible. So we have to embrace it, right? We have to embrace it. And you know what? Our mission is very simple. Our mission is we want to leave a better healthcare system for the next generation.
Very good. Thank
That's
you,
all
Dr. Prasad. You heard it from Dr. Prasad. We have to leave, healthcare in a better state for the next generation. I'm just astounded by this, and I'm so impressed with your description as well as the book. And we're excited about what it means. And you heard it from Dr. Prasad. So we'll be back with him and next recordings about this, resetting healthcare. You've heard it from Brightside Global Trade TV, how to do this using Surgiqual. So thank you so much. And we really appreciate you being on board with us, Dr. Prasad.
Thank you
And
so much.
you're watching Brightside Global Trade TV. We do reviews, interviews, broadcasts, and now we're hosting events. And we are here with Dr. Sanjay Prasad. We're talking about his book, Resetting Healthcare, and we hope you will get a copy of this book. I will make sure that we have all his information available in the comments section. And if you'd like to be part of research or part of this big initiative that he has stepped upon to changing or resetting healthcare, and not just making this about an individual, but converting the whole country into rethinking this whole process. We will make sure that you are able to reach him and have his website information. And we really encourage you, especially the payers who are paying the cost for this, the insurance companies, the government. Elton and I have spoken at NIH and CDC,
Okay.
and this is something that we'd like to talk about, and especially about diversity groups. So you are watching Brightside Global Trade, and make sure you subscribe so you never miss a video.
Okay.
Thank you
Very
so
good.
much.
Thanks, Dr. Prasad.
Thank you. Thank you so much.
Very good. So, all right.